I want to welcome Dr. Seema Massand, an MD for Advantage Care Physicians. Thank you so much for being with us here, Doctor.
Thank you, Jessica, for having me.
So just wanted to get a little bit about you. I know we have had a bunch of your colleagues from Advantage Care Physicians the past month or so have been helping us out with this show. Just wanted to learn a little bit more about you and where specifically you work in terms of, what borough or what neighborhoods here in the city.
So I'm part of Advantage Care Physicians family, and we have about 40 offices and spreading throughout all of the 5 boroughs as well as Long Island. I personally practice in Hicksville, and most of our offices have been in these communities for decades and have been serving our communities for decades. So I'm very proud to be part of this ACPNY family.
And thank you so much again for giving us your time. I know, you guys are still super busy just trying to keep up with everything that is going on, the newest updates, of course. I did want to kind of start off tonight talking about the mask factor. We are supposed to be wearing them according to, Governor Cuomo, who told us and made that requirement in that executive order that all New Yorkers should be wearing them if you are stepping out of your home at any point during the day, whether it is for work, if you are an essential worker, or if you're just going out to the grocery store or pharmacy real quick. So we are getting to obviously some nicer weather now. We are seeing that, small groups are able to be together outdoors and gather if you are practicing social distancing, if you are still taking precautions. There's a lot of people saying, I'm walking down the street, I'm not seeing as many people wearing masks, We know the numbers have gone down, but, from your perspective and from a doctor like you in your position, I just wanted to talk once again about the importance of wearing this mask. Dr. Fauci and Governor Andrew Cuomo saying it's simply about respect. Can you talk about that?
Absolutely. And Jessica, yes, you bring up a very valid point that the weather is getting better. We have been indoors for over 2 months. We are itching to get out and meet with friends, families, etc. We still have to do that with a whole lot of caution. We still have to do social distancing. We still have to wear those masks. And those masks we wear not so much for our own selves, but for our neighbors, for our friends, for our families, to protect them. And if everybody follows the same rules, we'll continue to see the drops in the numbers of COVID infections that we have been seeing over the last few weeks. So again, very important to continue to wear those masks.
Thank you for that. Just wanted to, everyone's kind of seeing different things, feeling different things, especially anticipating the reopening in whatever way that is going to look like. So I think just that antsy factor. So thank you for touching on that. I know we have Wendy on the line from Brooklyn Heights. Wendy, can you hear us?
Yes, I can.
How are you doing tonight?
Stress here and there.
Yes, same here. But thank you for calling in. What's your question for the doctor?
Yes. When this coronavirus started, all of the breast mammograms and breast sonograms, you were told to delay them. So I'm just wondering, because I haven't been hearing anything about when these facilities are safe enough to go so you can have these examinations done, because I know it's a skin and close exposure, and how safe is it to go in, because this is something that these examinations have to be done on a yearly basis, and you don't want to delay them.
You're right. Good question.
Absolutely, Wendy. Very good question. And now that we are starting to reopen, it's very important for all of us to make sure that we are keeping up with the routine screenings, our routine health and care of our chronic problems. So with regards to mammography, the radiology facilities have been open and have been doing some emergency testings, but now it's time for the routines. And you should feel safe in going to the radiology facilities, because all of them are following very strict protocols and procedures for sanitization. In between patients, they are cleaning, they are sanitizing all surfaces, and so you should feel comfortable in going there. But also, you have the right to know. So if there is a facility that you are going to, you can always ask them what their sanitizing procedures are, and what are they doing to keep their patients safe. But the appointments are being staggered. The facilities are being cleaned, so you should feel safe in going back and getting your routine testing done.
Thank you so much for that question, Wendy. And it's just great. It's a good reminder, I think, for some people. And thank you for being on top of that, thinking ahead, especially to those really important annual visits like getting your mammography. So thank you for calling in. And thank you again, doctor, for making that clear. I know Rosemary's on the line in Throgs Neck in the Bronx. Rosemary, how are you? Can you hear us?
Yes.
Oh, okay. I couldn't hear you. My bad. How are you doing?
Yes,
What's your question?
I'm fine. Oh, you want my question?
Yes.
Okay. My children live in a different state. I haven't seen them for a while, and I am thinking of taking a plane ride to see them. I'm well, and my children are well, and their children are well. So I'm thinking if I do take this plane ride, of course I know what precautions I have to do, but when I get there, will I have to segregate myself from them? How do I handle that if I decide to do that?
Again, a very good question. And yes, planes and airlines are taking all kinds of precautions, and you also need to take the similar precautions with sanitizing and wearing masks throughout. But you're right, once you get there, you get to them, even though you have taken your precautions, you should still try to maintain some distance from them, and it would always be safe to wear the mask even in their presence, whenever it is that you're spending time with them. Great
advice. Again, I think a lot of people are in that position where they're thinking about making that decision just to see people they love, you know. So as long as you follow those guidelines, just being in their presence, I assume, is going to feel so great. But, you know, at a distance and continuing to wear your mask, Rosemary, I think, you know, just like the doctor said. Thank you for calling in with that. And let's get to Angel in Bay Ridge, Brooklyn. Angel, how are you?
Okay.
You doing okay? What's your question?
My question is, there's different things being said about the antibodies. Now, if you get the antibodies, you supposedly already had the COVID. Now, can you get it again, or can you spread it if you have antibodies?
The antibody testing that is being done is synonymous with the serology testing, and that is being done to assess whether or not a person has had a COVID infection. Now, there's a word of caution there. Just because an antibody test is positive doesn't necessarily mean that the person has immunity. That's one. And two, we also do not know how long that immunity is going to last. So that is why you still have to continue to take all kinds of precautions, but it at least gives the idea of how many people in a community have possibly been infected and have possibly developed antibodies, and whether or not your plasma, your serum, can be utilized for research as well as for helping others in need. And that's something called convalescent plasma that is currently being used in studies to see whether we can give that to patients who are actively fighting the COVID infection.
Okay, great breakdown, because I know, you know, now we're talking about all this testing being done, and it is good that it's been ramped up, but with that comes, of course, more questions about the testing. So thank you for that. And it seems like time is really just needed to get those answers, you know, about immunity, especially. So thank you for that. We do have a social media question because we get a bunch of those as well. And Alan has this one real quick. After being discharged from a hospital, how long to wait to get retested? Are you still contagious even though you didn't have symptoms for 3 weeks while in the hospital?
So you can continue to shed virus for as much as 30 days. And there is no need to get retested unless you are one of those frontline workers that needs to be tested before going back into work. Again, taking precautions if at home also, if you have symptoms persisting like cough, or you should really be taking the precautions in wearing the mask.
Okay. Great advice there. And hopefully you are still doing well, to Alan, who wrote that question in for us on Facebook. But we're going to be back here with the doctor for more of your questions here on this coronavirus pandemic special. We'll be back. We are joined tonight by Dr. Seema Massand from Advantage Care Physicians, giving us her time to answer your questions. And I know we have Patricia on the line in Soundview. Patricia, how are you?
I'm doing fine, thank you.
Good. What is your question for the doctor?
My question is, I had a friend who passed away from the virus.
Oh,
I was
sorry.
her emergency. Thank you. I was her emergency contact, and had to go pick up her property. And what I have not heard anybody talk about is this property. So I had to go pick it up, and now I'm concerned with. Should I be nervous about this property because she wore the clothing and she's touched everything? So do I need to be concerned? What do I need to do?
Yeah.
So that's a great question again. And just the virus can live on many surfaces, including clothes. But it's unclear as to how long the virus can live on the clothes. The other thing is there doesn't seem to be any contamination, not contamination. There doesn't seem to be any transmission of disease through the clothes, but it's always safe to use caution. So when you're outside, and just like you said, you brought back the property of your friend, if you have used gloves and you have kept that aside in a covered plastic bag, then you should be okay. You do not need to fear for your own health, and you need not fear that you're going to contract the disease from that.
Great question, though. Thank you so much for calling in, Patricia. And you're right, that's not something we've been speaking about at all. So thank you for bringing that to our attention. I mean, I can't imagine going through what you went through, of course, losing someone that you love dearly, and then having to deal with everything after that, which includes picking up her belongings, too. So thank you for calling in with that question, and I'm so sorry for your loss. Let's get to Carmen, who's on the line in Pelham Bay. Carmen, can you hear us?
Yes, we can. I can.
Awesome. What is your question?
Okay. A little while ago, maybe 2 or 3 minutes, a lady had called saying the travel, that you had suggested that her keeping her distance in her travel, seeing her grandchildren and herself. But I feel she didn't ask how long does she have to be with a mask, keeping distance, and in-house for over a month. I live in New York, and I plan to travel to Florida. But if I stay there a month, do I have to stay a month with a mask on? Or how, everybody talks about 2 weeks, 7 days, 14 days, that you're okay if you don't have any fever or anything like that. But here we're planning to go to Florida for a month or even longer. So what do we do?
Yes, your concern is quite right. And what you also have to think about is when you're in contact with your grandchildren, we also need to not only protect them, we need to protect you. And if the grandkids are going out and playing with other kids, coming in contact with others, and even though they may be using the precautions, they are possibly carrying some of that virus back. So it's safe for everybody as much as possible to wear the mask. And if that means that you have to wear the mask inside also when you're hanging out with your grandkids, then for your sake and their sake, that would be a good idea to do so.
Is there any sort of time limit? Like she was asking, if she's down there and does that for 2 weeks, is there a point that you can kind of start to let go of that? Or are we going to have to see where we're at in a few weeks?
The 14 days quarantine period, or the 14 days being careful period, comes from the fact that the virus, once a person is infected or has been exposed to it, can contract the illness within 2 weeks, which is 14 days. The being careful ongoing time period is that continued possibility of exposure. And as I was saying, if those kids are going out, if the grandkids are going out and playing with other kids, there's a possibility they are getting exposed. And then if they are bringing the infection back into the home, then why take a chance? And it's always safer to be careful. It's safer to have that mask on. It's safer to sanitize as much as possible. So yes, you can give your grandkids a hug, But again, it's better not to be doing that without the mask on.
Got it. Thank you. Thank you for that. Let's get to Rosa in East New York, who's on the line. Rosa, how are you doing tonight?
I'm great, thank you.
Good. What's your question? Thanks for calling in.
Well, my question is, I had the antibody testing done about a week ago, and the results came back as detected. So I'm a bit confused as to what that really means, whether I may still carry the virus in me, or, I mean, I have a 78-year-old mom, and I have a 7-month-old grandson, and we all live in the same household, so I don't want to have to, you know, keep myself away from them if I still carry this. What are my choices? What is it that I need to do?
So if your antibody is detected, it means you have developed antibodies. So what that means is that there is a possibility that you came in contact with somebody with COVID, and your body either contracted the virus or you were an asymptomatic carrier. That is, you never developed the symptoms, but your body just produced those antibodies. So when you have antibodies, you're not carrying the virus. You're not going to transmit that infection to your family members. So you don't have to worry about that part. What is still not very, very confirmed yet is how long is that antibody providing us with immunity, the person who's carrying the antibody. We do not know for how long that is providing the protection to us.
Got it. Okay, so if she is living with her 78-year-old mother and that little baby too, everyone should have those masks on and keep distance still? We're going to be back. Thank you so much for everyone who called in or who's watching there from your homes. We also want to give a big thank you to Dr. Seema Massand from Advantage Care Physicians, who answered so many of our viewers' questions tonight. And I know we wanted to end on something the mayor definitely spoke about and announced yesterday, a new partnership between Advantage Care and the city and state. Do you want to expand on that?
Absolutely, and thank you for talking about this. We have just recently signed up and partnered with the state, Governor Cuomo, as well as the city of New York. We are an intrinsic part of the fabric of New York City. We practice in the boroughs. We have our own employees, our staff that live in the communities. We serve the communities. So we want to be able to test our communities, and this important partnership will provide access for our patients to come in and get tested. And this testing is done after you have seen one of our providers in a virtual visit. The provider can assess you, see what is the appropriate test for you, and then accordingly order the appropriate test. Once the test is done, we are also here to answer any other questions you may have, and it would be a pleasure to see you in our offices.
That is huge. So definitely a new thing that our viewers can take advantage of, especially in terms of asking those questions too, and getting that virtual visit, getting the test, and then asking any more questions they have. Thank you, doctor, so much for spending time with us tonight, and I hope you stay well.